Why Northwest Florida isn't warning you about Vibrio Vulnificus. Experts speak out. The absence of public health alerts for Vibrio Vulnificus in Northwest Florida sparks outrage. Perdido Bay, Fla. Recent reports from the Florida Department of Health, FDEP, indicate that 13 individuals across the state have been diagnosed with Vibrio vulnificus, a potentially dangerous bacterium. This year alone, 3 cases have emerged in Northwest Florida, specifically in Escambia, Santa Rosa, and Okaloosa counties, with each county reporting 1 infection. As the number of cases continues to climb, local health and environmental specialists are expressing their dissatisfaction with the insufficient public notifications regarding this health threat. Sava Varazo, an environmental scientist with nearly 4 decades of experience, has collaborated with both Escambia County and the FDEP. He has voiced his frustration over the lack of adequate warnings and signage that could help raise awareness about Vibrio vulnificus. 12 years ago, there were numerous alerts posted whenever there was a significant risk of harmful conditions. They issued tidal alerts for swimming safety and shark warnings. So why not for health alerts concerning bacteria? It used to be common knowledge. You would see those signs in places like Bayou Chico, Bayou Texa, Navy Point, and Pensacola Beach. Now they seem to have disappeared. I believe the health department should take more responsibility and truly embody their role as a health authority, Varazo stated. While cases of Vibrio are infrequent, the state typically sees around a dozen reported annually. These infections are often contracted in warm bays, bayous, and brackish waters. Individuals with weakened immune systems, open wounds, or those who consume raw shellfish are particularly vulnerable. Certain demographics are at a heightened risk for infection. This includes anyone with an immunocompromised condition that diminishes their immune response, as well as individuals on medications or suffering from diseases that weaken their immunity, explained Norman Beatty, an associate professor of medicine at the University of West Florida. Additionally, we must consider those with liver diseases, such as cirrhosis, as they are particularly susceptible to Vibrio infections. Where News reached out to the Escambia County Health Department to inquire about any active cases and the procedures they follow to investigate Vibrio infections. Unfortunately, no representatives were available for an on-camera interview. However, they did provide a definition of Vibrio and a link for further information. Our state officials are making every effort to disseminate these bulletins, especially during this critical time of year, Beatty remarked. We are striving to raise community awareness, which is why I am discussing this issue today. Things are just not happening as they used to, Varazo lamented. I can't help but wonder if this is due to political motivations or budget constraints. The public deserves greater accountability from government agencies tasked with keeping them informed. If you're interested in learning more about Vibrio vulnificus, you can visit the FDEP's website here, https://www.floridahealth.gov/diseases and conditions, Vibrio infections, Vibrio vulnificus, index.html. Rather health.right go to least wanted can access sign Vibrio part of pub and back to 2020 vaginal infections with them. Isn't it liquorency se to hangon över infekt precis för att prevent I kan säga att jag i går som inte vet så jag då Stefan Ringkök som själv eller vis via lotion har hänt då så I like tot är då över att den sen så like a handle of works for. Stay safe from flesh-eating bacteria, tips the beachgoers. Imagine a microscopic threat lurking in the waves, invisible to the naked eye, yet capable of turning a fun day at the beach into a life-threatening ordeal. This is the reality of Vibrio vulnificus, a rare but deadly bacterium that has claimed lives and left others battling severe infections. While these cases are infrequent, their severity demands attention, especially as climate patterns shift and warm water temperatures become more common. But here's where it gets controversial. As global temperatures rise, experts warn that these pathogens could become more prevalent, forcing us to rethink how we interact with nature. And this is the part most people miss. Even the simplest precautions can drastically reduce your risk. Let's break it down. Vibrio vulnificus, often dubbed the flesh-eating bacteria, thrives in warm coastal waters, particularly along the Gulf Coast. Though the name might sound like something from a horror movie, the bacterium doesn't literally consume tissue. Instead, it triggers a severe infection that could destroy skin, fat, and muscle layers, a condition known as necrotizing fasciitis. The real danger lies in how it enters the body. through open wounds, cuts, or by consuming undercooked seafood, especially shellfish like oysters. In 2025 alone, Florida reported 4 deaths and 7 illnesses linked to Vibrio, sending shockwaves through communities reliant on coastal tourism and recreation. But the risks don't end there. Another, even rarer threat exists in freshwater environments. Naegleria fowleri, the brain-eating amoeba. Found in warm lakes, streams, and even poorly maintained pools, this single-celled organism can cause a fatal brain infection if it enters the nasal passages. While cases are exceedingly rare, around 40 reported nationwide from 2011 to 2022, the consequences are catastrophic. How do these two microbes, so different in habitat and behavior, share a common thread? Climate change. Warmer waters are creating ideal breeding grounds for both, a fact that raises urgent questions about how we adapt to protect ourselves. So, what can you do to stay safe? Let's start with Vibrio. First, if you have a cut or open wound, avoid saltwater or brackish water entirely. If you're already in the water and get injured, exit immediately. For those handling seafood, thorough cooking is non-negotiable, especially for oysters, which are often the source of infections. Cross-contamination is a silent killer too, so keep raw seafood separate from ready-to-eat foods. And remember, even a tiny scratch can become a gateway for these bacteria. Cover wounds with waterproof bandages and always wash your hands with soap and water after handling raw shellfish. If you notice redness, swelling, or pain at the site of a wound after water exposure, seek medical help immediately. For Naegleria fowleri, the rules are simpler but equally critical. When swimming in fresh water, hold your nose or use a nose clip to prevent water from entering your nasal passages. In hot springs or shallow lakes, keep your head above water. Avoid digging in the sediment as the amoeba tends to cluster there. If you use nasal irrigation, stick to distilled or boiled water, never tap water. Crucially, you cannot get infected by drinking contaminated water. The amoeba only causes harm when it reaches the brain through the nose. Now here's a question to spark debate. As climate change accelerates, should governments invest more in public health campaigns about these microbes, or should individuals bear the responsibility of education and prevention? Are you underestimating the long-term risks of warmer oceans and lakes? Share your thoughts below. After all, staying safe doesn't just require knowledge, it demands that we act on it together. UF Health warns of flesh-eating bacteria. Florida deaths highlight risk. Flesh-eating bacteria claims 4 lives in Florida. UF Health expert issues warning. The threat of a deadly flesh-eating bacterium has reared its head in Florida, claiming 4 lives, and experts are sounding the alarm. Gainesville Fla, a University of Florida infectious disease specialist, is urging Floridians and visitors to exercise caution following the recent deaths linked to a dangerous bacterium found in the state's warm waters. 2 of the fatalities occurred in St. Johns County, according to reports. The Florida Department of Health confirmed that the deaths were caused by Vibrio Vulnificus, a naturally occurring bacterium that thrives in saltwater environments. This bacterium can cause severe illness or even death, especially in individuals with compromised immune systems or pre-existing health conditions. Dr. Norman Beatty, an associate professor of medicine in the Division of Infectious Diseases at the UF College of Medicine, explains that the bacteria can enter the human body in 2 main ways: through the consumption of contaminated shellfish, or when open wounds come into contact with infected water. The initial signs to watch for are pain, swelling, and redness, Dr. Beatty advises. If you suspect exposure to brackish or salt water, particularly in areas near the Gulf, it's crucial to seek medical attention immediately. For most healthy individuals, the effects might be limited to mild gastrointestinal discomfort. However, those with weakened immune systems, such as people with liver disease, are at a much higher risk of developing life-threatening infections. We've seen patients arrive at our hospital in critical condition, Dr. Beatty notes. In some cases, the infection has spread rapidly up their legs, necessitating surgical interventions, including debridement, and in extreme cases, amputation of a limb. The rapid progression of the infection is what makes it particularly dangerous. Symptoms can appear within hours of exposure and worsen quickly, making early recognition and treatment essential. The speed at which this infection can spread is truly alarming, Dr. Beatty emphasizes. It's vital to act fast if you notice any unusual symptoms. Despite the risks, Dr. Beatty encourages everyone to continue enjoying Florida's beautiful natural resources, provided they take appropriate precautions. I want people to go out and enjoy the summer, he says. Just be mindful and prepared. The Florida Department of Health offers several recommendations to reduce the risk of infection, including avoiding raw or undercooked shellfish and staying out of saltwater or brackish water if you have open wounds. Any wounds that do come into contact with such water should be washed thoroughly with clean or sterile water. Although Vibrio Vulnificus infections are relatively rare, the consequences can be dire. According to the Centers for Disease Control and Prevention, the CDC, approximately 1 in 5 people who contract a serious infection will die, sometimes within 1 to 2 days of becoming ill. But here's where it gets controversial. Some argue that the media and health officials are overhyping the danger, suggesting that the risk is minimal for the general population. What do you think? Should the public be more concerned, or is this just another case of unnecessary alarm? Share your thoughts in the comments below. To stay informed about the latest health advisories and tips, subscribe to our newsletter here. Copyright 2025. The Copyright 2025 WCJB. All rights reserved.